Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
We're live from St. Augustine. Hope you're having a good day so far. Katie Armstrong has stopped by to help us play the music, and she's a longtime friend of WSOS, and she has been on the air with us for many years, and she's part of the great team at Lakeview Health. Lakeview Health, one of our country's leading alcohol and drug treatment centers that just happens to be located right here in Northeast Florida. You can learn more about them at lakeviewhealth.com. That's lakeviewhealth.com. Good morning, Katie.
Good morning.
How you doing?
I'm doing great, but I'd really like one of those broadcast team shirts like you have.
Oh, you want one of these shirts? Yeah. That can probably be arranged. You know, they're very fashionable.
They are.
Yeah, I get a hard time for those. You brought along a special guest today.
I did. I brought along Dr. Brian Jackson, who's a partner with Families and Addiction Experts. We've known each other for many, many years. And
Too many to tell. Right?
Yeah, too many to tell. And so we're really lucky to have him here with us today.
Yeah, and he's been with us in the past, too, along with Diane McQueen and others, and we appreciate the work that you all are doing. We'll get back to Lakeview Health for just a second, though. Dr. Jackson, explain to us what you all do.
Well, we focus on the families. You know, we have people with substance use disorders, and a lot of times families really don't know what to do. So after decades in the industry or, being a counselor, Di and I decided, the dynamics of each and every family is different. And so we spend a lot of time working with families in terms of, helping them figure out if they're enabling or not, or setting healthy boundaries, how they can get on with their lives and not make their happiness contingent on the wellness of their loved one.
Right. And Katie, how does Lakeview end up working with Dr. Jackson and his team?
Well, we've worked together with Dr. Jackson and Diane McQueen, over the years when they are working with a family who has a loved one who needs treatment, and if they're successful in trying to get that person to accept the help, they refer them to our treatment program, our residential treatment program. And now, when we have families who need ongoing help, once their loved one is discharged from our treatment program, we many times refer, if they're local or sometimes even if they're not, because you can do work virtually, we refer back and forth often because we trust them with our patients and their families.
Yeah, absolutely. Once again, we're spending time with the good folks from Lakeview Health and Dr. Brian Jackson. And Dr. Jackson, if people want to learn more about what you all do to help with families especially, what's a good way for them to connect?
They can find us on familyandaddictionexperts.com, and there's a button there you can push for a free consultation, and we can meet with you and see if, we feel like we can assist you, or you feel like we can assist you.
You mentioned the term sometimes families or individuals get in a situation where they're enabling drug and alcohol abuse issues. Give us an example of that.
Well, it's very difficult for families because they love their loved one.
Sure.
And, the person that's, suffering can pull on their heartstrings. And sometimes, especially financially, we find families, I hate to say this, but co-signing their addiction by giving them monies. And there's always this fear that if they don't, something bad is going to happen. So what we really work on is changing, families changing their reaction, if you will. It's almost like an invisible intervention, changing their behavior and sparring and, letting the whole family.
Tug of war?
Yeah, whole tug of war, the whole family being controlled by this addiction. And it's amazing, and Katie and I have talked about this, is that when the families change the way they react or don't react with the person that's suffering, a lot of times the light bulb will go off in the person, who's suffering and say, they're making changes, like what's going on here? I'm pretty much on my own. Maybe I need to take a change. So that's really what we're looking at. I'm a big proponent, even with my own children, that I'm not going to give them money to facilitate bad behavior or dangerous behavior or risky behavior. But if they're doing the right thing, and that's what we encourage families to do, is say, hey, if you can help them, if they're moving in the right direction in terms of going to treatment and getting well, that's money well spent.
Hey, you can connect with Dr. Jackson and his team by going to familyandaddictionexperts.com. That's familyandaddictionexperts.com. And I would think, Katie, especially after treatment at Lakeview Health, interaction and success with being with your family again is critical, right?
It is, very much so. We feel that treatment at Lakeview Health in a residential setting is the beginning of a lifelong recovery. And so many times things are uncovered in treatment in our family program, because we do have a family workshop and a family therapist on staff. And when problems are identified and those behaviors need to be fine-tuned, they need to be followed by someone who really knows what they're doing. And Brian and Di can easily do that for us. So,
yeah. Well, once again, if you are a family or an individual and you're struggling with drug or alcohol addiction issues, or maybe you think you might be, maybe you're a family member or a loved one of someone who is struggling and you just don't know what to do, you want some help, well, we have a resource for you that's not even going to cost you anything, right, Katie?
That's right, exactly. Don't even have to give your name if you don't want to. So the number you can call is 904-204-1553. Again, that's 904-204-1553.
That's right. You can always go online, too, to connect with Lakeview Health at lakeviewhealth.com. We should know, too, I'm going to give you that phone number again a few more times that Katie just gave out, but you can access that number 24/7. That's right, 24/7. So be sure to make use of it. We'll be back.
When I was a little boy,
A little short guy, right, Katie? Paul Simon.
Yes, but I love him anyway.
Yeah. Apparently doesn't like being made fun of his height either. No comment.
I doubt it.
Yeah. Saw a recent interview of him on CBS Sunday Morning, though, and I was very impressed. You know,
The one from Austin?
yeah,
Yes.
where he's in his of all places that he's spending his retirement in Austin, Texas. I mean, beautiful place, but
With his wife.
Yeah.
That's where she's from, right?
yeah,
Edie?
yeah, and they live out in sort of the sticks, if you will, on a ranch. But he has this beautiful studio, and still making music. He's doing
Right.
great stuff, right?
I love that interview. Yeah,
Yeah.
it was wonderful.
If you hear Katie Armstrong's voice on the radio, you can basically bet the house that we're going to play some Paul Simon and Elton John and maybe some Fogelberg and maybe a little bit of Sting too, right?
Right.
That's
Throw
required.
in some Sting.
Yeah.
One Rod Stewart.
And we'll do a Rod Stewart. Yeah. Because,
yes.
Yeah, Dr. Jackson wants to hear some Rod Stewart. We're spending some time with, of course, Dr. Brian Jackson and Katie Armstrong. We're talking about drug and alcohol addiction issues, which continue to be a challenge here. We just had Sheriff Hardwick on here about 10 days ago, and that continues to be a never-ending challenge here and throughout the country, right?
Never ending story. I think the opioid deaths are going down. However, that's just one aspect of our problem. So, I feel like a really lucky person sometimes that I get to represent Lakeview Health, because what we do inside those walls helps save people's lives every day. So,
And I got a lesson from the sheriff about just, some of our local high schools here, some of the best in the state, but he estimates that, upwards of 30 or 40% of the kids are actively using drugs, and that it's so easy to get drugs now. So we got an education in that. There's no drug dealer anymore. You just basically get on Snapchat, and there's drop-off points, and it makes it very hard for law enforcement to do anything about it.
right.
Yeah.
Really hard to track that.
Yeah. What do you see, Dr. Jackson, in terms of young people and how young are they impacted by drug and alcohol issues?
It really is very prevalent, and as you said, you said 30 or 40% of the children are using or experimenting anyway with alcohol or drugs or some sort of substance. But it's really not a good thing because we've got the adult side of the brain, and then we've got the impulse side of the brain, and as teenagers, that adult rational side of the brain is trying to develop and really doesn't fully develop until age 24 in males. 22 in females, imagine that. And but once you introduce alcohol and drugs, you're really slowing down that process, and so the brain gets hijacked. That impulse desire for the goodie is very, very strong. And I think it's interesting that over time people have said, oh, if we could just eliminate this drug, this thing, that everything would be okay. But if you think about prohibition, we did away with alcohol thinking that would solve the problem. Then everybody started smoking cigarettes, and next thing you know, they're dying from cancer. And so then we cut down on that, and then, there's big talk about, we got to get rid of fentanyl, we got to get rid of opioids. But my experience anyway with a person who has an addiction is that they will find something else. So really where it begins and ends is at Lakeview, where we work on the addiction to whatever it is. Because it's, the drinking and drugging is but a symptom of something else, and typically, there's some sort of dual diagnosis that needs to be addressed.
Yeah.
So,
They may be self-medicating.
Yeah.
They may be self-medicating depression and anxiety, bipolar disorder, and things like that.
Or some
So,
trauma they've had in their life.
trauma.
yes,
a lot of
trauma,
trauma.
a lot of trauma.
Mm-hmm.
If you know someone who is struggling with those issues and the resulting drug and alcohol addiction issues, we highly recommend Lakeview Health. And, of course, you can connect with them at lakeviewhealth.com. If you call this phone number, too, they'll figure out the whole insurance coverage issue. They can also walk you through whether or not Lakeview is an appropriate program for you. If not, there are other resources in our community here in Northeast Florida, and they'll take care of all of that for you. And it's not going to cost you anything. It's a great resource, and we encourage you to share it with others. There's inevitably, in everybody's family, there's somebody that is having to help somebody or trying to help somebody who's dealing with an addiction.
That's absolutely correct. If you don't have a family member, you have a friend or a coworker. So,
Yeah. And if you think no one around you is not dealing with these issues, it's because, you just don't know about it yet.
that's right. You're not
it'll-
listening,
That's right.
perhaps.
Get your head out of the beach sand. Here's a number that you can call, right?
That number is 904-204-1553. It's 904-204-1553.
Call that number. Let them know that you heard about it here on WSOS. We would appreciate that. Go to the website if you can't remember the telephone number, and I know that's hard to remember phone numbers, but you can remember this, lakeviewhealth.com. That's lakeviewhealth.com. You can learn more about Dr. Brian Jackson, of course, by going to familyandaddictionexperts.com. That's familyandaddictionexperts.com. We just put his contact information and Katie's up on our Facebook page and Instagram at WSOS Radio. We'll be back.
Addiction treatment space for many years. I would say close to 20. And I've been at Lakeview Health 11 in September, I think. So my job is, because I have so many connections in Northeast Florida, down to Gainesville, Daytona, over in the Panhandle even, my job is to be the liaison between people who need treatment and our treatment center and those people who are going to interact with people who need help. For example, I work with criminal defense attorneys who have clients who have DUIs or some other offense they've committed while under the influence. I work with mental health counselors, psychiatrists, family practitioners, hospital ERs, so they understand that a lot of these people they're seeing in their practices need addiction treatment, and I connect them with our treatment center. And we are privately owned. We're not part of a big corporation, so we have a lot of autonomy to do the things we feel are really needed in a treatment center to be successful. So I'm sort of the face and the mouth of Lakeview here.
Yeah, no, I think it's a key role that you play, and it lets other people here in the community know, whether they're healthcare providers or law enforcement. I know you've met with Sheriff Hardwick and others,
right.
that Lakeview even exists because there's always new people
Right.
coming in, new people that are leading community organizations and the like that may not be familiar with Lakeview Health. You should get familiar with it, though. LakeviewHealth.com. Like I said, just about all of us are going to have someone in our circle who need and could benefit from drug and alcohol addiction services. Dr. Brian Jackson, same question for you. What exactly do you do? How would you summarize it? What's the 30-second elevator speech for family and addiction experts?
Well, I've been working in the field for over 23 years, and I myself am in my 25th year of recovery. Initiated with a 33-day stay at the Betty Ford Clinic. So, basically do a lot of counseling. I do a lot of substance use evaluations for family court and also for criminal court. It's critical, I think, when children are involved to make sure that they're in a safe environment. I owned an intensive outpatient treatment facility that I worked at for 20 years. So just reconnect. It's a very small community. Katie and I are very close in terms of, knowing, who the players are and where the appropriate places are to refer people to. Because we don't do everything. There's places where they might need medication-assisted treatment, or families may need, some individual, more intense therapy. So basically, we're just out in the community. I mean, we're really busy right now, and that's good because people are reaching out for help, and there's no shame in reaching out for help because it can become very, very uncomfortable for family members if they have a loved one that's suffering.
Yeah. Well, once again, you can learn more by going to the website familyandaddictionexperts.com or go to lakeviewhealth.com. Also, if you're struggling, you can call this phone number. Katie's going to give it to you twice.
This number is 904-204-1553. Again, that's 904-204-1553.
All right. We'll be back. release here on 103.9 WSOS. Hope you're having a good day. And indeed, he's sending out an SOS. That should be like our theme song.
Oh, that's right.
Yeah, I never thought about that, huh?
Oh, there you go.
You could get Sting to do a promo for you.
Oh, I'm sure. I'll just have him send you the bill. You know, you can handle
Sure.
that. Speaking of sending out an SOS, indeed, a lot of folks out there that are struggling with drugs and alcohol issues, could use some help. And a lot of you may be driving around right now listening to us, and you've been told by family members and others that, hey, you may have an issue. You may want to look into that. Sometimes it's a gentle nudge, and if that's kind of banging around in your brain a little bit, it wouldn't hurt to just talk to a trained counselor at Lakeview. It's not going to cost you anything.
Right.
Right?
That's exactly right. Won't cost you a thing.
Yeah. And so you can determine, what your options are. There's no high pressure anything involved with Lakeview Health. So I would encourage you to learn more by going to lakeviewhealth.com. And if you're somebody who's trying to help someone who's struggling with drugs and or alcohol, you should check out that website too and call this number that Katie's going to give you in just a little bit. Katie Armstrong is here with us, and she's part of the great team at Lakeview Health, and she brought along Dr. Brian Jackson, and he works with people on these addiction issues as well. And when you're involved in helping folks, Dr. Jackson, why do you consider working with Lakeview? And I know you have for quite some time.
Well, that is a very easy question. So
Katie.
If I was faced today with going to Betty Ford or going to Lakeview, I would choose Lakeview. And the reason I say that is because the whole process, my experience has been seamless. I can contact Katie. We can get in touch with the intake people. They do an interview of the person that we are working with, and they get to know all the idiosyncrasies of that person that need to be worked on, be it trauma, be it, some form of depression and or anxiety, some family stuff. And the program at Lakeview is not a cookie cutter template. And I say that because I see that at a lot of inpatient treatment facilities. They really work with the individual. I mean, we've got psychiatrists on staff. They have psychiatrists on staff, doctors on staff. They provide exercise. They have a wonderful gymnasium. The nutrition is really thought about. There's a lot of thought that goes into, what people are being fed. So proper nutrition, proper sleep is so key. And they really treat in a very holistic way the entire individual. Mind, body, and spirit. And it's a very, very comfortable. And like you said, you can make a call for free. I think a lot of people have contempt for inpatient treatment without investigation. And so this is a really easy way to investigate, get all your questions answered. But the other thing that I love, when we do have people that we've referred over there, we do get weekly updates from the primary therapist. And I stay hands off, but it's nice to get those updates and see how the person is progressing. And then they really focus in when the time for the person to leave is, and doing a very, very complete discharge plan for a continuum of care. So it's not just, hey, you did great for 30 days, goodbye. They really, really care about, people getting well and, more importantly, staying well.
And that's key, right, to maintaining sobriety over time, over years, right?
Exactly, because when you're inpatient, it's pretty easy not to use unless they're serving cocktails out the backside. But when we get out, we're out. This is where we use in the real world. So dealing with life on life's terms and all the tools that are available to you, Lakeview kind of highlights that for people and works with them in formulating the treatment plan. They don't dictate it; they give them options, and so. The patient is not powerless in terms of making choices that they think will be, helpful to them. So it's really a collaborative of it, between the therapist and the patient.
Yeah, and we do that in a gender-specific manner.
Yes.
Mm-hmm. The men and women are treated in completely separate programs, completely separate buildings. The only thing they do together is the family workshop.
Mm-hmm.
And if they are in the professionals program, like if they're a flight attendant or a pilot, a nurse or doctor or lawyer, they're in a group twice a week for professionals, and they're together in that setting. But other than that, the men and women are completely separate. So if you're listening and you're a female or a male and you have issues you wouldn't want to talk about in front of the other gender, it's a really great place to feel safe and discuss your issues. So
takes another impediment out of the process of
Right.
becoming sober and achieving your goals, right?
Right.
And also, I should mention, Lakeview Health, they've been doing this for many, many years, and an amazing, beautiful campus, of course, in Northeast Florida, and a process that has been tweaked and redeveloped over time, right?
That's right. That's right.
You can learn more by going to lakeviewhealth.com. Share that website, too, with others, people in your family, folks at work, friends, neighbors who have mentioned to you that they are trying to help someone in their circle that's struggling with drugs and or alcohol. It's all over St. Johns County and St. Augustine, so there's no shame in it, at all.
Right. I think that a lot of the work that's been being done now really has helped to destigmatize this problem. It's a medical issue, and I think it's starting to work. So
Yeah.
that's good.
Well, once again, go to lakeviewhealth.com. That's lakeviewhealth.com. But here's a phone number where you're going to get to speak with real human beings, no AI chatbot or anything, an actual person.
Right.
They themselves in recovery, trained counselors, available 24 hours a day. They'll answer this telephone, this telephone number, and Katie's going to give it to you right now.
That number is 904-204-1553. Again, it's 904-204-1553.
Dr. Brian Jackson, great job as always. Thank you very much for all your time and for coming in today.
Well, thank you. It's a pleasure to be with you, and I love your tunes.
Well, thank you. And I hope that you'll
Thanks, Brian.
learn more about Dr. Jackson and his work by going to familyandaddictionexperts.com. That's familyandaddictionexperts.com. Katie, one more time with the phone number.
The phone number is 904-204-1553.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.